All right, guys, we're going to get started here in just a second. We'll give another minute or two and let some of the stragglers log on and get situated. Give me just a minute and we'll be rolling. All right. So we're going to go ahead and get rolling here because we got a lot to talk about tonight, and so I don't want to use up my time. I'm going to try to be quick and also thorough. So remember we're doing a multi webinar series on disease triggers, and last webinar we started off things with food sensitivities, and we talked a lot about how food sensitivities will drive different inflammatory mediators, and how that can create a lot of different symptoms and different problems. But the big thing was the inflammation and really inflammatory mediators that come from food sensitivities. And so that was kind of what we hit on last time. So tonight we're going to be talking about part 2, or number 2, of the disease triggers, and we're going to be talking about chronic infections. And so as we dive through here, we've got a lot of stuff to kind of cover on that, but let's just kind of get rocking here. So for those of you who aren't familiar with us, I'm Dr. Justin Snyder. I'm a chiropractic internist and currently working towards a second diplomate and being board certified in anti-aging and functional medicine. And so I work with a integrative nurse practitioner Beth Letta, and then we have our CFO, and then my wife, who's our practice manager. And so that we are Pro Health Center, and a little bit about why I became a chiropractic internist, and kind of what got me into the chiropractic internist functional medicine world were my children, and some of the autoimmune problems that they've had, and I had as a kid growing up. And so that was really kind of something that really drove my passion for doing what I do. So with that being said, let's kind of jump in here and let's talk about triggers to abnormal physiology. And like I said, we hit on food sensitivities. This seminar is going to be a 2-part seminar because we're going to talk a lot about chronic infections and different forms of infections this time. And then next time, we're going to talk about some of the therapies and different treatment routes that are available for some of these chronic infections. I hope tonight that you guys are going to get some information that you've probably never heard of or didn't have any kind of clue. It's interesting because some people, when they have a disease process, it's kind of like, oh, well, I have this and that's the end of it. Or, I've got a treatment which might be a drug. But most people don't understand how that actually occurred. How did they get to that point? And, part of understanding how they got to that point is a big part in actually correcting, correcting the problem. And so with that being said, if you look, the literature shows that infectious agents, whether it be bacteria, funguses, viruses, parasites, these things that we know that they can trigger not only autoimmune diseases, but other disease processes, even cancers. because of how they create molecular mimicry, and really they just create a dysregulation of the immune system. And so, like the literature says, it's important to note that an infection may not necessarily be the inducer, but rather the total burden of infections from childhood on that trigger autoimmunity and then also disease, right? And infections and autoimmune diseases, infections will absolutely exacerbate any autoimmune condition. And so, the literature is very clear on this. And what we understand is that it's not always just one infection, or it's not just one trigger. But if you have food sensitivities, and let's say you're eating those foods on a consistent basis, you're creating inflammation. And then now we're talking about having chronic infections, or even the total burden. So maybe you've had a lot of exposures to infections and your immune system did not handle it well. So all these things are gonna add up, and they kind of prime the pump and they set things in motion. And sometimes it is that one infection that triggers that kind of breaking point. So the first one we want to dive into is Lyme disease. And Lyme disease has been around for a while, but it's very underappreciated and underdiagnosed in a lot of areas. And what's interesting is we actually kind of classify Lyme disease into two different forms. And we have Lyme disease, and then we have what we would consider a chronic Lyme disease. And so Lyme disease, for those of you who are not familiar, is a bacterial infection that comes from tick bites. Now, typically we say that, Lyme disease comes after 24 to 72 hours of a tick being attached to you, but it doesn't take 24 hours for that tick to necessarily transfer that bacterium, okay? So, but Lyme disease is one that can really create a lot of problems for a lot of people. And, understanding that, and we're going to dive through this, that once a Lyme disease process turns to a chronic disease process, chronic Lyme, it really starts to wreak havoc on people and their immune systems, and it starts to create all kinds of symptoms. And so some of these symptoms are fatigue, that's very common. Fatigue, pain, especially pain in the joints, muscle aches, and these things will last even after they've been treated. So maybe they did have the bullseye rash, and they got treated with antibiotics, and they thought, hey, I'm done, I'm good. But actually what we're finding is that Lyme disease itself can actually still being occurred after antibiotic usage. And a lot of people, when we see chronic fatigue syndrome, Lyme disease is one of the suspects in that. And there are other things that can cause that. But again, when we think about Lyme disease, okay, Lyme disease, one of the things that is kind of striking is two things to me, and this is something I see, a good bit clinically, is number one, when you look at the bacteria of a Lyme disease, the ability for that bacteria to be killed by antibiotics is actually fairly low, okay? And so you've got about 2 to 4 weeks from exposure to nip the infection in the bud. Once you get past about 4 weeks of exposure, if you haven't killed the bacteria, there's a good chance that you're not going to, and it's going to cause a long-term infection, and that's where we get into more of the chronic, the chronic Lyme, if you will. And so the crazy thing is that when you look at the antibiotics, okay, treatments, most of these antibiotics, they can't penetrate into a bacteria cell wall of the Lyme pathogen, okay? And so again, that's really how the modern medicine is treating Lyme, if they make the diagnosis and if they make it in time. And so what you'll see is when we're dealing with chronic Lyme, we can have patients that have symptoms, and this is after 30, even 60 days worth of antibiotics, okay? And they actually may have the same amount of infection occurring at 30 days post antibiotics, or having antibiotics for 30 days as they did, before they even started the antibiotics. And so what we're seeing in the literature is that long-term antibiotic therapy is not working, right? And it's not relieving symptoms of patients who have had exposure to Lyme. And so, this is something that really can wreak a lot of havoc in people. And so, understanding this, when we think about Lyme patients, think about what symptoms are coming from this, or what problems are coming from this. And so in a chronic Lyme, like I said, fatigue, that's very common, but cognitive dysfunction, your brain doesn't work right, headaches, sleep disturbances. There's other neurological problems, even demyelinating diseases, peripheral neuropathy, motor neuron disease, excuse me, neuropsychiatry, psychiatric presentations, cardiac presentations. These are some major problems. So when you think about somebody who has, they have hard time recalling facts, they have short-term memory problems, when you have patients who have issues with coordination, you see the neuropathies. I mean, these are things that actually can be driven from a chronic Lyme disease. And, most people, if they, let's say maybe they got bit by a tick and they rolled on, and, months to years down the road, all of a sudden they develop some kind of, neurological problem, they're most likely not putting it behind them that, hey, this could still be Lyme, this could still be part of that tick bite that I had, years ago. And it absolutely can be. And so, just because you took an antibiotic does not mean that necessarily that the Lyme is fixed. And so when we look at, chronic Lyme disease, right, and that's what the literature shows, is that antibiotics, they're not showing that they work very well, because they can't penetrate the cell of that bacteria effectively. So that cell, Lyme, the bacteria that comes up with comes up with the Lyme disease, has a dual cell wall. So there's two cell walls, and what happens is that the antibiotics never actually make it all the way into that bacterial cell, and so it doesn't kill it. And there's actually something called an efflux pump, and what that is part of is it's something that tries to kick out antibiotics, and it's part of the survival mechanism of that bacterium. And so when we use antibiotics, and like I said, it's very challenging to kill the Lyme bacterium and to get Lyme disease under control. And you've really got about a 2, maybe 4 week window to get on that. And another thing is that these bacteria are what's called a spirochete. So they burrow into the body tissues, okay? So they can burrow and hide themselves, in a sense, in your body's tissues. And this can make it extremely difficult to get under control. And the whole time you're creating a tremendous amount of inflammation, because you have a bacterial infection that is, number one, hiding from your immune system, and number two, that your immune system's having a very hard time getting, under control. And so it's just a major drain. And the other issue that we see with Lyme disease is, a lot of times ticks don't just carry that bacteria that causes Lyme, they carry other bacteria. And so a lot of times we will see co-infections. And sometimes it's because the tick has multiple pathogens. Sometimes it's because the body is fighting other infections, and now it has Lyme. And so now the body's really being overrun. There's not enough soldiers on the line to hold the line. And so the body starts to become overrun. And so when we see these chronic infections of Lyme, you always want to check for the co-infections. And a lot of times, actually, when you look at the Western blot, which is kind of the more mainstream test for Lyme, it does tend to give quite a bit of false negatives. Okay, so it's not a very reliable test. That's why a lot of people that have Lyme aren't diagnosed with Lyme, and uh, that Western blot test does not test for any co-infections. And so we've actually seen patients that have co-infections, other infections that you tend to see with Lyme disease and from tick bites, And so the co-infections can create sometimes almost as much of a problem as the Lyme disease itself. And so some of these co-infections are things like Bartonella, Borrelia. You will see those. Those are more of your bacteria and parasitic type infections that go along with this. Even if somebody has a reoccurring Epstein-Barr virus, okay? Epstein-Barr and Lyme, they look very similar in their presentation from a symptomatology standpoint. And so if somebody has an Epstein-Barr, man, they get Lyme, they are really going to have a fight on their hands because typically people that have Epstein-Barr virus that have reactivations, they're having a struggle just on their own. And if they have anything with Lyme, they can really create a problem. But, again, when you think about the symptoms, you think about the problems that these patients have or these people have, it is fatigue. Sometimes it's muscle pain, it's arthritis, it's headaches. You can see all those different neurological symptoms with Lyme. The other thing is another reason why sometimes we see Lyme and it's not really known until symptoms are present and it's down the road, is because in children, according to the literature, 25% of children with Lyme disease don't even present with the rash, okay, with that bullseye rash. And that's kind of always been like the mainstream medical kind of the cue of, hey, this is Lyme disease. Is, do you have the bullseye rash? If the answer is no, then no, you don't have Lyme disease. But, in almost a quarter of the cases, especially in kids, they won't even develop the rash. And that can also go for adults. You don't necessarily develop the rash when you have Lyme disease. And so if somebody gets bit by a tick, they pull the tick, they get the head, they think, all right, we'll just watch it. And, 2 weeks goes by, seemingly no rash, no fever, everything's fine. Well, guess what? Then down the road, a couple months, a year or two down the road, they start having fatigue, they start having joint pains, they start having all these things. And guess what? It absolutely could be Lyme, or it may be one of the co-infections. And so, I can tell you Bartonella has a rash that goes with it. It doesn't look anything like what the bullseye rash looks like. So again, sometimes the rashes do not necessarily add up with whether you have Lyme or the co-infections. But what we see is in a lot of patients, these disease processes, they become chronic, they cause a tremendous amount of inflammation, they really stress the immune system, and then they open the door for other infections and they open the door for other problems because the immune system is getting overwhelmed. Now, we talked just a little bit about Epstein-Barr virus and EBV. That's kind of it's a bad one. So Epstein-Barr virus is very common, and depending on the literature and some of the statistics you read, they say somewhere around 90% or so of the world has Epstein-Barr virus by the time they're 20 years of age. And so Epstein-Barr virus, it is also a herpes simplex virus, and there are several herpes viruses, and so they're called HSV, and so herpes simplex viruses, Epstein-Barr is one of those viruses. And the crazy thing about Epstein-Barr virus is it can do a lot of things. And for most people that have good, healthy, functioning immune systems, most people don't even realize that they got it, kind of like COVID. But for those that are compromised or they have other, infections or other kind of processes of autoimmunity or anything going on, Epstein-Barr can really create a problem. And this is just one of the articles that I wanted to share with you guys, because look at the title. Epstein-Barr virus protein can switch on risk genes for autoimmune diseases, right? EBV may trigger some cases of lupus, right? And so what we know is that Epstein-Barr, it can persist in patients and people, I mean, throughout their life, okay? Once you get the virus, it's not something that, kind of just goes away and you never have it again. It does anchor down in the body. And commonly, it does like neurological tissue, but it can also tend to dive in other tissues. And so Epstein-Barr virus can create a reactivation process. And in doing such, you get what's called a cytotoxic cellular immunity. And so when it reactivates, it can start to create chronic fatigue. It can start to create fevers. It can trigger the changes in your DNA for different disease processes. Okay. So very common. Some cancers, we know that Epstein-Barr is actually a big driver of some cancers. We know that it can drive a lot of autoimmune diseases, all right, and autoimmune-like diseases. We know that chronic fatigue and muscle pain, even swelling in the brain, encephalitis, those are things that absolutely can come from Epstein-Barr. And we talk about herpes simplex viruses being able to reactivate, and probably the most common example of a herpes simplex virus reactivating would be shingles. So the herpes zoster virus is what causes chickenpox when we're young. It buries into our neurological tissue, and that's where it kind of goes dormant. And if a person later in life becomes compromised in their immune system, or they get very stressed out, boom, now we have a shingles outbreak. And that's a perfect example of a herpes simplex virus reactivating. And so while that is the zoster virus, the herpes zoster virus, we're talking about the Epstein-Barr virus, which again is also a herpes simplex virus. It does similar things, but instead of shingles, where you have the rash right through the neurological dermatome, Epstein-Barr is going to really wreak havoc on the body. And it depends on the person as to what that presentations look like, but it absolutely will wreak havoc. Now, here's the other thing. For kids, for children that, and I won't say children, more teenagers, common, but in about 30% of cases, Epstein-Barr virus causes mono, okay? And so we're familiar with mono, and so that is a very common presentation in about 30% of the cases. So, this is not something that we're not familiar with, but again, understanding that Epstein-Barr, it can do some damage. And you guys know, if you've ever seen somebody, or if you've ever personally had mono, I mean, it can wipe somebody out for several months. And when a Epstein-Barr virus reactivates, it's very similar. In those people that tend to be more predisposed to that, that's part of why they deal with chronic fatigue. Okay. But understand that when Epstein-Barr virus, when it infects your immune cells, you produce a protein. It's a nuclear antigen, and that thing helps to recruit other proteins, right, to basically make Epstein-Barr viruses, right? And then you get the transcription, right? So you get this kind of impression of the virus's DNA onto your cell's DNA, and it starts to change the genetic expressions. And so that's why when we have an Epstein-Barr virus, the risk for lupus, multiple sclerosis, rheumatoid arthritis, IBS, inflammatory bowel disease, juvenile diabetes, other arthritises, celiac disease, these things are very common when we have a patient who has had a problem with Epstein-Barr. And I have seen probably 3 or 4 people in my practice that have MS, and every one of them had mono as a kid. Now, I'm not saying that, Epstein-Barr is the cause of that mono, or of the multiple sclerosis, but every one of them had mono, which means they had a bad presentation of the Epstein-Barr virus. And some of, I believe 2 of the 4 cases of the multiple sclerosis, not only did they have mono, but they had some reactivation after that. So again, it's very common to see, cases of multiple sclerosis with mono and the Epstein-Barr presentation, and typically you'll see that a lot with lupus as well. But autoimmune diseases, very common when we're dealing with Epstein-Barr. When we think about cancer, right, Epstein-Barr can cause Hodgkin's lymphoma, Burkitt's lymphoma, non-Hodgkin's lymphoma, nasopharyngeal cancers, okay? And so we know that through the literature, okay? So a lot of the lymphomas, very, very, very commonly driven by the Epstein-Barr virus. And so when we see that, again, just like I said, very common to see MS cases with Epstein-Barr, very common to see, some lupus cases with Epstein-Barr. If you see a Hodgkin's or Burkitt's lymphoma, again, it's very common that Epstein-Barr is kind of behind that process. And it may not be every one, but a majority of cases, a lot of times there's going to have some Epstein-Barr virus there. And so, knowing this is why, when we do our next series, we talk about therapies and treatments, this is why you need to know this stuff, because if you've had a history of Epstein-Barr virus with mono or reactivations, or you're having symptoms, you want to try to get on top of the Epstein-Barr and get your immune system healthier before it drives some kind of cancer problem, right, or autoimmune problem. So we've got to make sure that we get that under control. So let's talk about another similar virus. It's called the cytomegalovirus. Okay, this is one that kind of gets overshadowed by Epstein-Barr, but it is also another herpes simplex virus. So, already tonight we've hit 3 of the herpes simplex viruses. And, just understand that also herpes simplex viruses, they're very similar in their reactivation ability and the way that they can kind of hide themselves from the immune system and the way that they can continue to survive. But cytomegalovirus is one that can cause retinitis, and so you get a lot of inflammation of the eyes. With that, but again, it can affect the gastrointestinal tract. So esophagus, stomach, liver, gallbladder, pancreas, colon, ulcers, inflammation, colitis. Difficulty swallowing, nausea, vomiting, abdominal pain, bloody diarrhea. You can even have, because it is a herpes simplex virus, it affecting the nervous system. So, again, cytomegalovirus can create some kind of crazy symptoms, and it's not very commonly heard of. It's not something that a lot of patients are aware of, but again, when you have patients that have some of these chronic problems, it very well could be the cytomegalovirus. Let's see. So, oral infections. Oral infections can do a number of things, and I cannot stress enough the importance of going to the dentist, getting your teeth cleaned, but not just, that is important, okay? So I don't want to take away from that. But understanding a lot of oral health and hygiene is more than just going to the dentist and brushing your teeth, okay? And so when we think about your overall health, okay, oral health is extremely important. And what we know is based through the literature, the medical literature shows that in a lot of cardiovascular disease cases, you find the same bacteria in the plaque of your arteries as you do in your mouth. So when people have, a pathogenic mouth, right? They have a mouth that's got bacteria that are pathogenic. You're swallowing that, and that's going into your gut. And if that gets absorbed in through the gut, it's getting into the bloodstream. So it's so common to see, cardiovascular disease when you have an oral infection. Okay, even rheumatoid arthritis, right? A lot of rheumatoid arthritises, there are a lot of times you're going to see bacterial type infections in the joints. And again, you can see that. And then they also in 2016 found a study that kind of linked the same type of bacterium to the risk of pancreatic cancer. And we've been seeing a good bit of pancreatic cancer lately. Obviously, that's when we tend to lose. We lose the game with most pancreatic cancers, and so it's pretty quick. But we know it's documented so thoroughly with cardiovascular disease and oral infections. And so, periodontitis, again, it's more than just brushing your teeth. You've got to make sure that you are taking care of your health. They have oral probiotics. There is actually a test that we will run with certain patients where we actually look at the bacteria in the mouth, and based off of the bacteria, we can assess what kind of bacteria there are in the mouth in your salivary secretions, and we can also see, are those bacteria pathogenic? Are they going to potentiate disease and problems, or are they the good stuff? And so if you have pathogenic bacteria in your mouth, you're basically creating systemic exposure, right? And again, that can initiate and cause progression of cardiovascular disease. It creates an inflammatory problem. The other issue is not just between swallowing that stuff, but you have lymphatic drainage through underneath the mouth, and so through the gum. And so again, you've got to make sure that you take care of that, the health of your mouth, because it will create a tremendous amount of inflammation. And there's even been case studies and cases where people with oral infections, and they have, not only the heart problems, but they can have neurological issues as well. And so, again, it's pretty kind of crazy, when you start thinking about oral infections and how many people are walking around with oral infections. I mean, really, based off the literature, it's probably the most common form of infections, for humans. So make sure you brush your teeth, but and we're going to talk more about being healthy. So let's take a gut check here, okay? Because when anytime when we think about infections, it's like I explained to patients, if there's potentiation of a chronic infection, we've got to look for infection in the mouth, we've got to look for infection in the gut, we've got to look for infection in the blood, and we've got to look for urinary tract, right? So those are the main areas that infections like to hide, okay? And so the gut and GI infections, very common, very under diagnosed, very unappreciated, really, in a sense. And so, last time we talked a lot about food sensitivities, and we talked about the small intestine, and about 70% of your immune system is found in your gut, right? Your gut is kind of a home base for your immune system. The gut and the lungs are probably the most concentrated areas of immune function, but the gut being the biggest. And they are big drivers of what we call the autonomic nervous system. And that's the part of the nervous system that controls, all of your automatic functions. And so when you see that, when you see that autonomic nervous system, it also drives part of your endocrine system. And the endocrine system is the area of which you are going to control your hormones through, okay? So really, there's three major systems that run the body, okay? You've got the immune system, the endocrine system, and the nervous system. And those guys have to be healthy. Well, guess what? Your gut really plays and sets the tone for both your nervous system and your endocrine system. So your hormones, as well as your brain and your brain function, is going to be driven by how healthy your gut is. And so when we talked about food sensitivities last time, we talked about tight junctions. We talked about the cells in your gut lining and how they need to be healthy. And we talked about how food sensitivities can drive damage to the gut, right? It inflames the gut. But there's also, and what we looked at last time, there's also other factors involved, right? So not just foods, but we can also see viruses and bacteria and parasites, right? There's other things that can drive this. And as we damage the gut and we create a gut lining dysfunction, now we can start driving and setting the stage for more autoimmunity, more food sensitivities. We can start seeing systemic inflammation. We can start having absorption problems, so we don't bring in the nutrients that we need from the food. We're not digesting our food properly. And if it goes on long enough, we can actually start breaking down the brain barrier, and we can start affecting the brain and inflaming the brain and driving neurodegenerative diseases. And so, the layman's terms, like we talked last time, leaky gut. Leaky gut is really a layman's term. Medically, we're talking about hyperpermeability of the gut. And so if we have leaky gut, not only are we driving food sensitivities, but we're going to drive other problems too. And that autoimmunity and GI infection, man, that's really going to set a stage for not only the autoimmune process, but neurological function as well. And then it's going to trickle down into our hormones. So we absolutely want to make sure that we are taking care of our gut. And here's what when I was reading through some of the literature for this, this just rung out so well. And I just wanted to take a second to just read it, because I try to explain this to so many patients, and it a lot of times falls on deaf ears. I think they do hear me to a degree, but they're kind of like, let's move on. But this is the literature talking about mucosal immunity, and it's talking about the gut. And it says, for thousands of generations, humans ate food shortly after harvesting and when it was in season. Meat was occasionally consumed. Much of it was caught in the wild. But in the past 50 years or so, right, our foods have undergone a considerable transformation. We have developed new strains of grains, especially in wheat, rice, soy, and corn. The United States uses more genetically modified crops than the rest of the world combined. We use chemicals such as pesticides, fungicides, right, insecticides for crops such as fruit and vegetables. We inject dairy cows with hormones, pass them into into the dairy products. We have antibiotics. There's heavy metals and arsenic. And we also are using artificial preservatives and colorings and flavorings, artificial sweeteners, right? Soft drinks. We consume more than twice the amount of salt we should in a typical day. And that drives autoimmune disorders. It can drive cardiovascular issues. We've got an abundant use of other plastics and environmental toxins. And again, like I talked about last time with food sensitivities, the widespread use of antibiotics, antacids, proton pump inhibitors, histamine 2 blockers, and other drugs, they are going to drive changes to the gut, and they're going to cause a trickle down effect with triggering of autoimmune diseases, type 1 diabetes, Crohn's, multiple sclerosis. We've talked about that. So if you're trying to get healthy, you've got to address what you put in your mouth, right? And I try to explain that to patients, like, we have to build a foundation. If you're going to build a building, you start with the foundation, and you better make a strong foundation. Your food is your foundation, and what you put in is what you have to build upon. And if you put sugar and junk and crap in, you don't have shifting sands to build on, right? You're not going to be able to maintain health. And my mentor, he said this in the very first class that I ever took with him, and he said, you'll never out supplement a lifestyle problem. No matter how good you've got, what herb you've got, what nutrient you've got, you're never going to out supplement a lifestyle problem. So step one with all health problems is you've got to get a person eating healthier, eating the right foods, and exercising and drinking water, right? If you can't do that, you're going to have an extremely hard time getting the rest of the pieces to fall into place. And so, I tell patients that, and I look at them and say, are you committed? Because it's going to take some commitment to make the changes, because you can't just, this is not a diet. This is not a, let's give this up for Lent. This has to be a lifestyle change. It has to be consistent over time. You cannot do it for a month and go, well, I feel better, so I'm going to go back to doing what I did. What got you healthy is what keeps you healthy, right? And that has to remain all the time. So when we think about our gut health, right, the first step in gut health is making sure that what we put in it is healthy, right? That's the first step. Now check this out, because this kind of blew me away when I first heard of it too. You have 10 times more bacteria in your gut than you have the total number of cells in your body. Okay? So when we look at the bacteria as a whole in your gut, we call that a microbiome, or the microbiota. Okay? And you have 150 times more bacteria, right, than the number of genes in your body. Okay? Which basically means your bacteria in your gut are running you, right? You're not running them. And so when you have 10 times more bacteria in your gut than you have cells in your body, and 150 times more bacteria than the number of genes in your body, how much, are you made up of bacterial genes, or are you made up of human genes, right? I mean, really, in a sense, you make up bacterial genes. So you have to understand that because our gut is so concentrated, if that balance, if we start to create an abnormal or a dysfunctional balance of certain bacterias, man, that's going to have a major impact on our function, because they make up so much of who we are. And so when we look at leaky gut, right, like I said, step one in gut health is making sure that what you put in is healthy. Okay, and here's why, and this is why 70% of the immune system is found in the gut, and this is why this is so important. Okay, your gut lining has cells, and right, and they're called epithelial layer of the gut, right? It's the major barrier between you and what's outside of you. Okay, if you think about it, inside your gut is actually outside of your body, right? If you were to go straight down through your mouth, while we think about that being inside our body, it's actually outside of our body. Because what goes into our gut, some of that goes into our body through the gut lining and into the bloodstream, right? And that's the stuff we want in. But the rest of it, we're going to kick out, okay? So that layer, right, is the barrier between you and the external environment, okay? And you've got the single layer of interconnected cells, okay? And they form those tight junctions. And those guys have to function properly to keep you healthy, okay? They are highly regulated, and they're only going to allow, or they're supposed to only allow, good guys in, okay? But what comes in has a lot of different variable factors based off of cytokines, based off of bacteria, your bacterial flora, and so the nutrients. And so what happens is if we start to damage those guys, we can create a problem, because now we don't have that lining. We don't have that layer of protection. And so whatever wants to come in essence, can start to come in. The other thing is within the small intestine, you have this area called a Peyer's patch, okay? And what it is it's a very specialized area with a specific immune tissue. And what it does is it helps to direct antigen sampling from the gut. And basically, it's what helps to regulate your immune system, okay? It's essential for gut health. If you do not have enough bacteria there, right, then in like a germ-free condition, you impair the immune response, because your immune system doesn't have enough coming in to be able to generate antibodies and antigens. And so you cannot start to create a line of defense, if you will, right? But if you have too much of that bad bacteria, the same problem can happen, because instead of not having any immunity, now you get overactive immunity. So you can have way too much inflammation going on, and you can start increasing your secretions through immunoglobulin A. And so what can start to happen is like I said, if there's not enough good bacteria, if there's not enough proper bacteria in that gut lining, you're not going to make an immune response. And if there's too much of the bad stuff, you're going to over respond. And we need to be right there in that sweet spot, right? We need to be just right. So when the gut breaks down, when that gut lining breaks down, that's what we call leaky gut. And when we create leaky gut, if it's not corrected over time, we create leaky brain. And that's where we start seeing the gut and the neuro autoimmunity, because we understand that the gut is our second brain. When we look at traumatic brain injuries, right? What we understand is that what affects the gut affects the brain, and what affects the brain affects the gut. They have a direct connection, and neurologically they are paired together. And so when you see that, if you see that there is compromise in the gut, you're going to have compromise in the brain, and therefore you're not going to have proper brain function. And this is why when people have, gluten sensitivity, they can't think, they can't remember. I mean, sometimes their speech can be slurred, and it all depends on the person, right? Every person's a little bit different. But I'm telling you, it is being documented that when we have a gut dysfunction, when we have food sensitivities, we're going to see neurodegenerative diseases, all right, as a progression. The other thing is stress. We've talked about viruses and bacteria and chemicals and all those things, but stress, chronic stress will change your gut flora, okay? And it will start driving interleukin 6, which increases inflammation and inflammatory mediators within the immune system. And chronic stress starts to break down the gut. And what can happen is you start getting something called LPS. So you have bacteria in your gut, they start producing lipopolysaccharide, or LPS, and that starts to get absorbed into the bloodstream, and that's a toxin. That is a biotoxin, right? And when we start seeing this leaky gut, this intestinal permeability, it can start driving other pathogenic roles, okay? Depression, right? I mean, fatigue, you name it, we start to see it. So making sure that what goes in is good, making sure that gut function is doing what it's supposed to be doing, minimizing stress, all the things that you've heard, but you've never really had it put to you in this position. Gut health, you've heard me also talk about this. I was just discussing, about neurodegenerative diseases. It is shown that, we start to see permeability in the gastrointestinal tract. You start getting molecules that get through the bloodstream that are not, supposed to be in the bloodstream. And if we see that blood-brain barrier breaking down, we're going to start seeing things getting into the brain, and it's going to cause an inflammatory response. Multiple sclerosis is another one, okay? And it is very common when you see a patient that has MS, a lot of times they're going to have some kind of GI dysfunction, okay? And so two things very, very common that occurs with neurodegenerative diseases, okay? So when we think about all of this, right, understand, you've got to, you either are going to make an investment or you're going to make an expense, right? And people understand that, right? Hopefully you understand that an investment is something that pays off in the long run, right? And an expense is something that costs you now, right? And so, while some people say, well, it's too expensive to eat healthy, well, I can tell you, you're making an expense when you buy cheap food, right? When you don't eat well, when you eat the candy bars, when you drink the Cokes, when you do those things, you're making an expense, because the total cost of heart disease, and this was based off of statistics from, I believe it was like 5 years ago, heart disease is going to cost $1 million, right? I mean, cancer costs tremendous amount, right? And so, when you think about the top two, causes of death, it's heart disease and cancer. Autoimmune diseases are on the rise. Females tend to have more autoimmune diseases than males, okay? And it's not to say that males can't have that, but what is the cost if you're diagnosed at, let's say in your 40s with a blood pressure problem or with an autoimmune disease, or some kind of issue that you now are going to be paying to treat that thing for the next 30 or 40 years of your life? What does that cost you? So again, understand, you're either making an investment or you're making an expense, and those are things that you absolutely have to decide, as an individual, when you're trying to be healthy. And like I told you earlier, and as my mentor always says, you can never out supplement a lifestyle problem, right? And so, the patients who make the changes, that make the commitment, those are the ones that actually heal. Those are the ones that get healthier. But you've got to maintain that. And so it's not necessarily always an all or nothing, right? It's not you got to make a night and day switch overnight, but you've got to start working to consistently be healthier. And you've got to understand how all these pathogens, how the food sensitivities play into your overall health, right? Because they build on each other. You may have had that, herpes simplex virus, that Epstein-Barr virus or cytomegalovirus. You may have had those when you were younger. You may have had, potentially tick bites. You may have had some of these things, GI infections. You've been putting in tons of sugar and creating a lot of what is called dysbiosis, where you've got too much of the bad bacteria. You may be creating these things over years. You're not going to fix that overnight, but you've got to start working towards that path of building your health because if you don't, it's going to fail you, right? And you're going to pay the piper. Whether you pay him now or you pay him later, you're going to pay the piper. And here's the thing. Some patients say, well, I mean, I'd rather be happy now and die early. And it's like, but that's the problem. Most people don't. Most people live it up now, and then they spend 10, 15 years miserable because they've got debilitating health problems, and they're just trying to treat themselves, and so they lose the quality of life. And that, that's not the way to go either. So you really have to ask yourself, do you want to be healed, right? I mean, is that what your goal is? Is that what you want? Because if that is the case, you've got to make the changes, and it's not easy. So remember, last time we talked about food sensitivities. You got to identify what foods are driving inflammation. We talked about the food sensitivity testing. We gave you guys a special offer that still stands. If you still want a food sensitivity test, we're taking $50 off for the rest of the month. So you guys have that through the rest of the month to get your food sensitivity test done. And also understand, if you've had health problems, you may want to check into some of these infections. I mean, this is, infections are, it's a big part of a lot of chronic health problems, and you've got to get those guys under control. Next time when we do the webinar, we're going to talk about different therapies and approaches to help with some of these chronic infections. And, again, I could have spent 3 hours tonight, and I could have covered mold, and I could have covered a bunch of other things, but just because of time, I hit some of the big ones. But next time we're going to hit some of those highlights again. We're not going to be able to cover everything that we can do and what we use, but we're going to cover some of the big hitters, and so you guys get a little more exposure to that. So we'll be doing that webinar next Thursday. So a week from this Thursday, we'll be doing that webinar. And then, if you have questions, if you have health concerns, holler at us, reach out to us. We can do consulting, we can do online consulting, we can do testing. Some of our testing we've been able to do, not having to come in the office, and so we can help you with that. But again, this is not for everybody. Not everybody truly wants to be healthy, right? Some people want to do what's convenient, and they're not committed to doing what it takes. And so again, if you're going to do these processes, if you're trying to get healthy, you've got to make that commitment, and you got to walk down that path, right? And we're here to help you, encourage you, and love you through that process, but you got to take the first step and the last step, right? So if you have any questions, feel free to shoot us an email, give us a call, check out the website. We've got some of our testing and different things that we do on our website, so you can go on there and get a little bit more information. But if you want more information about some of this diagnostic testing, some of these infections, please feel free to give us a call or shoot us an email. We'll be happy to discuss anything that we can with you. And if not, we will see you guys next Thursday. So hopefully you guys have a wonderful evening, and hopefully you get something out of that. If you have any questions, please let me know, and we will see you then. Have a blessed one.